Kashmir News Service presents.
One of the main important other concern, if we see from past couple of months, there is a massive surge in heart attacks, cardiac arrests. So what do you think, what is the reason behind this sudden heart attack?
You are deviating from corona to
So I'm
heart
shifting my
attacks.
focus to another question. We have discussed
Quite right.
COVID. Now I want to know the reason this sudden surge in COVID.
Before you switch on to the cardiac topic, I would complete the part of this corona. That is
So actually,
my
it's going
message.
Hello and welcome. I'm Sajad and you're watching Kashmir News Service. Today we are in the Sher Kashmir Institute of Medical Science. As we know, the SKIMS is one of the biggest est of Jammu and Kashmir, as it is serving the people day in and day out. Whatever be the circumstances, the institute is serving people, saving lives around the clock. So what has been their response during the outbreak of viral COVID-19? We have today with us the director of SKIMS Institute, AG AHANGAR. So we will just ask him a couple of questions. What has been their response in this COVID-19? सर पहले आपका बहुत बहुत शुक्रिया कि आपने हमारे लिए वक्त निकाला. So let me begin by asking that it's your second term as director of SKIMS Institute. So what achievements SKIMS did in your term so far?
So far, I have completed around 13 projects in my first innings from 2016 to 2017 end. There were a lot of projects that included PET scan that needed a new cardiac cath lab, a linear accelerated, and a boardroom, a drugstore, and many other projects, to name a few. Then I expanded the OPD as well as the emergency services of this institution. That was around 13 projects that I completed by the end of 2017, which the Honorable Chief Minister at that point of time inaugurated on 7th of January 2018. In the second innings, as I took over in October 2019, I have completed another spell of, say, around 12 projects so far. That included the most prestigious state cancer institution, the maternity hospital, a central drugstore, an engineering block, and so on and so forth. There are many other projects that I have submitted to the government, which we have discussed it with the Honorable Lieutenant Governor earlier on 3 occasions. And it has been ultimately given a shape in terms of the DPRs, the budget allocations, and everything is being discussed with the Department of Finance, for which we could not have the meeting on account of COVID in 2020. But otherwise, there are 14 such projects that will determine the future of this institution for next 200 years. Not only that, it will help us to outline the roadmap for the high-end care for the Sher Kashmir Institute of Medical Sciences as well as the Union Territory of Jammu and Kashmir. All these projects are, they include, the most important would be like an organ transplant center, a new cardiac sciences block, a new neurological sciences block, similarly a separate medical college in the campus itself, a medical university, and similar many other projects are in the pipeline. The most important another project would be getting the meditourism at this institution, which has been the dream of this institution when the solid foundations for this institution were built in 1976 onwards. We are at a prestigious lake which is known as Anchar Lake, and the meditourism has remained elusive till date. I'm trying to utilize the water body for a meditourism part of it, and for that reason, the adjacent locality of Baluchipura, which is already notified, and I have talked to the government on that score. We are trying to see and hope that the next projects for 13 to 14, which they are in the pipeline, will change the discourse as well as the propensity of the disease in Kashmir, as well as the modes of treatment available for next 200 years or so.
So, sir, in this COVID-19, since this viral outbreak has started, it has become challenging for the health sectors, hospitals to work out. And the SKIMS Institute of Medical Science is one of the biggest institute of Jammu and Kashmir, and you are receiving patients from all over the valley. So, how challenging was it for you people to operate in this COVID-19?
You see, COVID-19 struck the world all of a sudden. It started from China, it engulfed the entire world. It hit Europe very hard, it hit America very hard. It was expected that the subcontinent also will be hitting very hard. But that did not happen. The most advanced countries in the world, be it America, be it European nations, they came to their feet.
Yeah.
So COVID got them crumbling down, from disposable items to consumable items, from ventilators to drugs to antiviral drugs. Everything became scarce and everything was scary. The situation became so grim that all other crumbling economies in the world, felt like giving way. But so far as India is concerned, we had a little less of the mortality as well as morbidity.
Exactly.
If you see the world scenario, when it started in ending November 2019 in Wuhan, then suddenly within a matter of 2 or 3 months, the entire world got in its grip. At that point of time, when it struck Kashmir, we admitted our first patient on 16th of March 2020. Ours was the first lab in the Union Territory, in fact in the northern India, which tested the coronavirus disease. And we were certified and ultimately by the National Institute of Virology, Pune. Then onwards, the other labs came in Medical College, Srinagar, then SKIMS Medical College and Jammu. But earlier to that, it was Kashmir News Service Medical Sciences where the samples were processed and the ultimate brunt was on the institution. That was so far as testing is concerned. Now, simultaneously, a lot of patient load started pouring in, and the Institution of Medical Sciences was, as the high-end care for this disease. And we too started struggling to begin with. But thank God, we have been over a period of this more than a year now, we've been able to manage it so nicely. And at some point of time, we had a lot of patients. At one given point of time, we had about 300 patients. But that figure has come down to 15 today and zero mortality. We used to lose 2 or 3 patients in 24 hours. But last 2-3 months, the figures have been 0 to 1 sometimes. And it is so encouraging to know that we are not facing that wrath that the rest of the world faced. Entire Indian subcontinent did face corona far better than the world has faced it. If you see today's figures, today, if we go by the latest reports from Johns Hopkins University, the world has faced around 11.13 crores of the viral pandemic, and out of which 24 lakhs have died worldwide. If you talk of America, America alone got struck with 2.28 lakh people, out of which 4.9 lakh people have died. If you talk India, we have suffered a viral disease on account of probably 10.9 crores, out of which only 1.58 lakh have died. And in Brazil, if you see it, that was one of the worst hit countries. They lost 246 lakhs of the population, which is 2.46 lakhs in terms of the total deaths. And if you go by the reports of the world's one of the latest or the leaders in epidemiology from America, Dr. Anthony Fauci, he says America has faced this brunt for the last 102 years to the score of the pandemic that we have faced. In other words, if America has lost about 5 lakhs of the people, that means in 102 years they did not face as many deaths. And if you combine the deaths on account of flu, influenza, chronic obstructive lung diseases, pneumonia, or Alzheimer's together, the death toll in America was not as much in the last 120 years as has been because of the corona pandemic only. The worst American pandemic at some point of time in 1918 was influenza pandemic. You did not lose as many patients as we have lost this time. So given the global scenario, the world over, we have seen that Indian subcontinent did not face as much of a wrath on account of corona. We have done far better. And Kashmir News Service Medical Sciences in that score has done a lot better. Our mortality figures have been very much as compared to any other tertiary care institution. And ours has been the leading center in terms of the testing and treating capacity. and in the entire Union Territory of J&K, with a sense of pride, I'll tell you that we have handled it very nicely. Our doctors, nurses, paramedical force has done a wonderful job. I'm proud of them. I salute them all. And our people also have cooperated a lot because of the various awareness campaigns from government, from the administration, from doctors, from paramedics, from all other people or the social organizations have played a tremendous role. And media has highlighted the significance of the containment of this virus and the treatment of this virus. And media has played a tremendous role as it deserved to, and it has done it beautifully. So is true of, I'm talking of the KNS News Services. You also done a wonderful role so far as the awareness is concerned. And I salute all these channels, especially the KNS as well.
So, sir, now the education department has decided to open the schools, and there are also apprehensions the second wave of COVID is around us. So, what would be your message, and how do you see this situation that this education department is going to open the schools, and there is now second wave? So, क्या लगता है कि कितना मुश्किल है, क्या करना चाहिए, क्या message रहेगी लोगों के लिए?
You see, you have to understand the way this corona pandemic came, and it took a very heavy toll of life. And the way we could control it was only by three important methods. That was observing an appreciable distance, at least 2 meters, using face masks, using social hygiene and hand washing. These were three important tools that we have been able to fight the corona pandemic from it is getting spread to the masses. But at the same time, the people who needed treatment or the ones who recovered of their own has been a very huge chunk, around 80% of the population. The ones who got infected and then got symptoms also and became obvious, visible spreaders, they observed all these, face masks and social distancing, hand hygiene, social hygiene, all these things. That made a lot of difference in containing the disease. Unfortunately, about 1.5 to 2% of the people have succumbed to this infection world over. And that way, we must be very careful. When you combine this 1.5% of the population that got severe disease, who needed intensive care management, who needed ventilation, high oxygen, antiviral drugs, and so on and so forth, you have to understand that that wasn't a small chunk. It was a very huge chunk of population, if you see, world over. So the word of caution is that while we are thinking that the infection has come down a little and the things have become a little better, government has stopped the restrictions, the lockdowns are not anymore there, the restrictions have been eased out, people are doing the business, schools, colleges, other institutions are getting started again, and the business has started again. The internet has given a lot of facility from working from home to other establishments, but we must never lower the guard. The one important writer would be that we must never lower the guard. We must maintain the vigil and the guard intact so that the infection does not come again. If you see, the world scenario is that there is second and third wave in different countries. Yeah. We unfortunately are likely to go into that phase, though so far things are not as gloomy. But you never know how the virus might take the turn, because this virus keeps on mutating, it keeps on changing its strain. This time, if you see the world over, there are about 5,000 strains of this coronavirus prevalent. How many of them are infecting the human population, nobody knows. And which particular strain, be it UK strain, be it South African strain, be it any other strain that might come up, will have a faster infectivity, will have a quicker infectivity, or might be even severity of the disease may be entirely different. So we need to be very careful. We don't need to lower the guard. We must maintain the social distance. We must use hand hygiene quite frequently. We must use masks. And whenever there is a patient who needs treatment, he or she should be immediately rushed to the hospital so that earlier the patient is detected, treated, the outcome will be better. If a person reaches a hospital very late, and when the multi-organ dysfunction is there, when the multi-organ failure is there, then the chances of that patient recovering become very, very gloomy. Even if you use antiviral drugs, you use any mode of treatment, you would convalescent plasma therapy, use even lung transplant or ECMO and other things. But the outcome will be proportionate to the detection of the disease very early and treating it at that point of time.
So, sir, one of the main important other concern, if we see from past couple of months, there is a massive surge in heart attacks, cardiac arrests. So, what do you think? What's the reason behind this sudden heart attack?
You're deviating from corona to
So I'm
heart
shifting my
attacks.
focus to another question. We have discussed
Quite
COVID. Now I want to know the reason this sudden surge in
No,
COVID.
before you switch on to the cardiac topic, I would complete the part of
you
this corona. That is
So actually,
my
it's going on,
message.
so
My message on the corona pandemic, and with this program that you are recording today, is very simple but very important. The most significant message that I want to give to my masses, to my brothers, sisters, today is, please, today, you've seen what corona has done for last 1 year. You've seen how much deaths, how much destruction, how much devastation, how much getting down from education
Economical
to business,
setback,
to economic, to every mode of life. Everything has suffered. If we want to live again, and if we want to live healthy, and if we want to survive, otherwise entire human survival is at stake. But if we are to continue this human race on this planet, we must observe some discipline. We must observe certain principles. And I repeat, maintaining social distance, using hand hygiene, using a mask is very important. With this, the other mode of treatment, I said, from antivirals to other modalities of treatment, from steroids to oxygen, may not be 100% accurate. But the last tool, the last weapon that is very effective against this corona pandemic is the silver bullet. That silver bullet is the vaccine today. There are about 105 vaccines being tested all over the world, out of which there are 2 leading. The Covishield and Covaxin are available in India. There are many other, like Sputnik in Russia. There are many other vaccines in UK and America, but the 2 tested vaccines today in use at mass level, after having gone through various clinical trials, is Covishield and the Covaxin. I have used it. I was the first person probably in the country after Honorable Prime Minister of India, Shri Narendra Modi ji, he launched the vaccine campaign. Soon after that speech was over, I was the first person probably in the country who got this vaccine. Then after me followed my other heads of department professors. And another 10 minutes later, a health worker from All India Institute of Medical Sciences got this vaccine first time. Then came director of the All India Institute of Medical Sciences. But I was the first person probably in the country to have it after the Honorable Prime Minister's speech. Having said so, I've got another dose of this vaccine also after 28 days. I have followed what is mandatory and what is routine and what is logist. At the same time, I must convey to all the people, all the viewers and all the audiences that this vaccine is very safe. We must take the advantage of this vaccine. Government has strategized the use of this vaccine. First the healthcare workers, then the security forces, then has come the turn of now, which will be from the 6th of March, will be for the people who are more than 50 years of age, who are vulnerable for this infection, and who are likely to have this immune, having immune compromised, affairs. They are likely to get this infection more, and their fatality will be very much. So the last phase will be for the people who are otherwise young, robust, healthy. You must use this vaccine. You must take the advantage of this vaccine. This is the only solid protection from getting this infection, defeated to its last.
So, sir, since you have discussed this COVID vaccine, this might sound stupid in saying, but still I will ask. जो लोग कहते हैं कि since this COVID vaccine has come into place, and people are saying that this might, as I said, this might sound stupid, but people कह रहे कि ये जो vaccine है, actually this is not COVID vaccine. This is something, it is related to population control or something else, because rumors are going higher.
You see, you have to
how
go,
would you like to respond?
My dear friend, you must go by the scientific logic. We should not go by rumors. The scientific logic says that corona became a deadly zoonotic infection. It shook the entire world. This is on the basis of statistical evidence. Similarly, on the basis of the experimental analysis and work of day and night for hundreds and thousands of scientists on this project world over in different labs with their blood and sweat together. They worked very hard and used the vaccine at different phases of the trials, have tested it on not only for themselves but other modes of investigation. As we know, there has to be a rationale in saying anything. You cannot go by the rumors. Rumors may talk anything, but there is a scientific logic behind all these things. There's a scientific exercise on these issues. Science is something which is very much affecting every aspect of our life. You cannot deny that fact. Please do not go by the rumors. Go by the solid evidence that the science has produced. Please use this vaccine as the ultimate deterrent against the coronavirus.
सो सर हार्ट अटैक्स की बात मैंने की थी, कार्डियक अरेस्ट, इसलिए कार्डियक अरेस्ट की क्योंकि जो पिछले 2-3-4 महीने से सडनली एक every day we are reporting, even today we have reported one cardiac arrest, a sub inspector SI from Tangdar Karna died due to cardiac arrest. तो क्या लग रहा है जो अचानक से कार्डियक अरेस्ट की मौत हो रही है लोगों की, इस वजह से क्या रीज़न लगता है इसके पीछे?
My dear sir, you see, the heartbeat or the cardiac activity or the action of the heart or the work of the heart is the center of the existence of a human body.
Young people are dying due.
Any life on this planet where circulation is dependent on cardiac activity. I'm particularly talking of the human beings. It is the heart which is a muscular pump which pumps the blood in our body, and we know its activity is say around 72 beats a minute in an adult age. It varies with the age, the heart rate and other things, but basically heart is a very effective, the most most important factor in human life. Probably this is the best pump that God Almighty has created so far as circulation is concerned and the human life is concerned, or the lives where circulatory system and heart are in coherence. People die of any reason ultimately because of any disease, and the end point is when the heart stops. When the heart stops, the circulation stops, the BP is no more there, perfusion stops, the brain, kidneys, lungs, liver, heart itself does not get blood supply, and that's how a person dies. The reasons for sudden cardiac death, I'm coming to the point, is either an advanced coronary artery disease wherein the blood vessels which are supplying to the heart are diseased beyond a certain level, which if they have not been detected, the treatment has not been instituted, or the diagnosis has not been done earlier, then a person can die of a massive heart attack, what we call as myocardial infarction, when the circulation to a major chunk of the heart gets affected and heart goes into arrhythmia. We call it as fibrillation, ventricular fibrillation, atrial fibrillation, or any such sort of thing. Or heart stops working as such, we call as asystole. That's one, that's the mode of death. Two is this heart can have a disease of its muscle itself. The myocardium may be diseased of its own, degenerative myocardiopathies. The other reason could be arrhythmias, as I said. The conduction system of the heart is not proper, is not working, has not been detected, has not been tested, and suddenly a person's heart rate either goes out of control or becomes very low. So either situation, a person can die. It may be a very
स्मोकिंग की बात हुई थी, सिगरेट्स या टोबैको या बाकी जो स्ट्रेस वगैरह, can these be reasons?
Yes, these can be reasons. The reason is, I said, the heart has to have a particular rate, a particular rhythm to be effective in perfusing the rest of the body. When you talk of stress, when you talk of smoking, all these things can add to the problem where heart rate changes. Maybe either it goes very low or it becomes very fast when the effective perfusion of the body does not happen. There are 5 S's, as I have been always talking of in many of the interviews through television, through other media I've been talking of. There are 5 S's that I stress on. The first is salt. Excess of salt leads to hypertension, and hypertension leads to high blood pressure, leads to many diseases, be it heart, be it the brain, be it kidneys, be it liver. It affects any part of the body, wherever you have the blood circulation. So excess of salt is a problem. Then excess of sugar. It leads to ultimately diabetes, and diabetes and hypertension, they together combine to damage our blood vessels. Again, be it the blood vessels of the brain, be it blood vessels of the heart, kidneys, liver, any organ, they suffer. The other S is sedentary lifestyle. If we keep on sitting at one place only, not doing much of the physical activity, whatever we eat, it gets deposited as fat, and it raises our blood lipid levels, the triglycerides, the cholesterols, and so on and so forth, and it ultimately chokes the blood vessels. It gets deposited in the blood vessels. So all these blood vessels ultimately, as they get choked, it leads to either heart attack, it leads to the stroke, or liver failure, or kidney failure. The other S is very important, that is smoking, as you said. Smoking combines and increases the problems of hypertension, the diabetes, and the stress together. The last point of S I'm talking of is stress. Stress compounds the picture of excess of salt intake leading to high blood pressure, excess of sugar leading to diabetes, excess of sedentary lifestyle and stress part of it. All these things combine together and worsen the disease. Whether that it's kidney related, whether it is blood related, whether it is heart related, whether it is brain related. So all these 5 S's are very important: salt, sugar, smoking, sedentary lifestyle, and the worst is stress. All these 5 S's must be minimized. If we have to live a very healthy life, we must minimize all these 5 S's to whatever extent possible.
So, sir, last question. Since you are the director of one of the biggest institute, and SKIMS is really one of the biggest institute in Jammu and Kashmir, so does this institute has framed any team to investigate to decrease these certain? Since I have said there is a sudden surge in heart attacks, क्या कोई team इसमें frame की गई है कि so that the reason मतलब जानने के लिए कि क्यों अचानक से ये जो रेट अचानक से लोग यंग पीपल आर डाइंग ड्यू टू हार्ट अटैक्स, कार्डियक अरेस्ट, क्या इस पे कोई?
I must tell you that Sher-e Kashmir Institute of Medical Sciences is not only a major tertiary care hospital, but is a university. By virtue of that fact, we do a lot of research. We get a lot of postgraduate and postdoctoral scholars who go through postgraduate training, through postdoctoral training, through as scholars for other doctorate programs, and that's all research based. So it's a vital component of each and every doctor working here. Each and every doctor has to go through this drill, and they are all working on it. There's a special group of doctors which we which they constitute as cardiology department and cardiovascular thoracic surgery department. So all these departments with other co-related disciplines, be it endocrinology, be it general medicine, be it general surgery, and all other related disciplines, continuously keep on working with each other. The genetics, the biochemistry, and all other related disciplines keep on working together with collaborative studies and go on looking for these things. It is not one-time study. It is not that heart attacks are happening today. It has been happening ever since the human life has been on this. And this is a continuous process, as is true of Sher-e Kashmir Medical Sciences. Our 2 such frontline departments are, as I said, cardiology and cardiovascular thoracic surgery. They continuously keep on doing those things. That's what I give in a nutshell as to what the ultimate outcome is of these programs.
Sir, you have given a compliment to Kashmir News Service, and I would like to give again an opportunity to tell the people a message ki what should we do at this moment, because there are reports that the second wave of Covid-19. So I want to give this message to people in Urdu or Kashmiri so that people can take this message and they may follow.
कोरोना के साथ हम 1 साल से ज़्यादा से लड़ रहे हैं. कोरोना ने जितनी तबाही मचाई है, हम उसका खमियाजा भुगत चुके हैं, मगर हमारे पास ऐसी रेजिलियंस भी है कि हम इस कोरोना को डिफीट कर सकते हैं. शुक्र है अल्लाह ताला का, हमने बहुत हद तक उसको काबू में किया हुआ. हमारे पास टेस्टिंग, कंटैक्ट ट्रेसिंग, ट्रीटमेंट जैसी फैसिलिटीज़ हैं. शेर-ए कश्मीर इंस्टीट्यूट ऑफ मेडिकल साइंसेज में हाई एंड केयर फैसिलिटीज़ हैं, जिसकी वजह से शेर-ए कश्मीर इंस्टीट्यूट ऑफ मेडिकल साइंसेज वो डेस्टिनेशन है जहाँ पे हर कोई शख्स, चाहे उसको कोरोना की तकलीफ़ हो या नॉन कोविड की तकलीफ़ हो, वो शेर-ए कश्मीर इंस्टीट्यूट ऑफ मेडिकल साइंसेज में ही आना चाहता है और यहीं पे उसका इलाज होना चाहता है ताकि वो यहाँ से शिफायाब होके वापस चला जाए. मगर इसके साथ मैं ये बात ज़रूर कहूँगा कि कोरोना के होते हुए हमने जो तकालीफ सहे हैं, इस कोरोना को ख़त्म करने के लिए हमें आज भी उसी गॉड को अपनाना चाहिए जिसमें हमने मास्क पहनना बहुत ज़रूरी है, सोशल डिस्टेंसिंग बहुत ज़रूरी है, फ्रीक्वेंट हैंड वॉशिंग बहुत ज़रूरी है, एंटीवायरल ड्रग्स का जहाँ पे ज़रूरी हो, स्टीरॉइड्स का ज़रूरी हो, कन्वालेसेंट प्लाज्मा थेरेपी जहाँ पे ज़रूरत हो, जो भी इन पेशेंट ट्रीटमेंट हो, हाई एंड फैसिलिटी से लेके जहाँ पे भी मुमकिन हो, हमें एक शख्स का इलाज करना चाहिए, उसको नेगलेक्ट नहीं करना चाहिए लाइटली नहीं लीचना। और सबसे इम्पॉर्टेंट बात जो है, आजकल चूँकि हमारे पास एक वैक्सीन आया हुआ है, हमें इस वैक्सीन का भरपूर फ़ायदा लेना चाहिए, ये बहुत ज़रूरी है। और अगर हमारी इस ह्यूमन रेस को इस ज़मीन पे ज़िंदा रहना है तो ऐसे वैक्सीन जो चाहे स्मॉल पॉक्स के लिए हो, मीज़ल्स के लिए हो, एड्स के लिए हो, या किसी ऐसे वायरल तकलीफ के लिए हो, पोलियोमाइलाइट्स ले लीजिए, किसी भी ऐसी जापानीज एन्सेफेलाइटिस लाइक थिंग्स। तो ऐसी एक वायरल तकलीफ जो है कोरोना है, जिसने एक वबा की सूरत इख्तियार की हुई है, इससे मुकाबला करने के लिए और इसका खात्मा करने के लिए वैक्सीनेशन बहुत ज़रूरी है। हमें इस वैक्सीनेशन का भरपूर फ़ायदा लेना चाहिए।
थैंक यू सर, थैंक्स फॉर योर टाइम, अपने वक्त निकाला हमारे लिए, इसके लिए बहुत बहुत शुक्रिया। सो दिस वाज द डायरेक्टर SKIMS AG Angar. He has shared an important message that no doubt that we have fight this COVID so far, but it's still we need to take care of our people, elderly, children. We need to follow the guidelines. We need to wear masks. I am Sajad for Kashmir News Service from Srinagar.
Thanks for watching Kashmir News Service.